Although there are many different causes of knee pain, one of the most common presentations we see is tightness of the ITB, the iliotibial band that runs down the side of the leg. It basically runs from the ilium in the pelvis to the tibia in the lower leg, hence its name. It's a particularly thick piece of tissue and it runs all the way down the side of the leg and it blends into the side of the kneecap. And that's where the tricky bit comes about. We believe that when that gets tight, it pulls onto the kneecap, making it pull out to the outside a little bit more, interfering with the natural tracking up and down of the kneecap. This used to be referred to as runner's knee. We're also seeing it now with people who sit a lot for a living or going up and down stairs, getting pain at the front and particularly on the inside of the kneecap. It's not often linked into a traumatic injury like a twisting injury or falling injury, but something that develops over time. One of the best ways to loosen this up is using one of these foam rollers, which have come onto the market in the last couple of years. They're very simple to use. You just pop it down onto the ground and then position yourself so you're starting up near the top of the hip joint where the ilium is, lying sideways, nice elbow bend, bottom leg straight, and the top leg over there just for a little bit of balance. And then almost in a reverse rolling pin action, dragging yourself across all the way down to the edge of the kneecap and back up again in one smooth motion. If you do come across a spot that you find is exquisitely tender, sometimes you can work on that a little bit backwards and forwards just to iron it out a little bit more. But basically we like you doing a nice smooth motion from the bottom of the kneecap all the way up to the top of the hip. You can go up and down 2 or 3 times, swap across and do the other side, keeping the opposite side nice and loose as well. Something that can be done a couple of times a day. Initially it can be a little bit tender, but if you give yourself a rest day, then get back into it, you'll find that the foam roller is ideal for sorting out tight ITB problems.